I appreciate it. I appreciate you all asking me to come and speak. I'll do my best to try to keep this to be kind of practical and efficient as we go through. If you have questions, feel free to unmute yourself and ask. I'll do my best to monitor the chat, but please just kind of jump in and ask as we move forward. I'm going to go ahead and share my screen. Let's see. Can you all see that? Yeah? Okay, great. So the residents in my department know that I'm a big fan of random or potty humor. I'm really sorry about this, but it made me laugh. I'm the father of 3 boys aged 5 through 12, and so there are lots of fart jokes in my house. But 2 weeks ago, my family was coming back from a long kind of extended stay with my brother and sister-in-law in New England, and we were driving through Missouri. And we found this sign. I actually took it from the car as we passed by. It's called the Uranus Fudge Factory. So I can't hear people even laughing. I know it's really bad, but it made me laugh. And there were these great signs that led up to this place, like signs that said things like the best fudge is found in Uranus and all sorts of things. So pretty bad, but at least we can start with a little bit of humor. Unfortunately, we weren't able to stop because we didn't want to get COVID in Uranus. But what can you do? So, okay, we're going to talk, there we go. We're going to talk a little bit about wellness. So I'm a clinical psychologist by training, and so I get asked this question a lot, kind of how do we deal with wellness, especially during periods of high stress. And I know we all find ourselves in a period of rather significant stress. I know you all have seen it in your clinical rotations. I've certainly seen kind of heightened stress in my clinic. And I'm certainly feeling a lot of stress, my family and I. We all face kind of different challenges. And so this is just a very different challenging time. So I'm going to talk about a number of things. And my hope is that a couple things. One, my hope is the things we're going to talk about will be helpful to you. Another thing that I hope is that none of this will be really new. I know that sounds a little strange to say, but a good friend and colleague of mine, I remember said right at the beginning of all of this back in March, he said, when things get complicated, go back to the basics. And I think there's a lot of wisdom there. When things get complicated, when things get really stressful, some of the best ways to manage that stress and to improve wellness is to go back to the basics, is to go back to the things that we know work and help, and find ways to creatively make those things work for us. So I'm going to be talking a little bit about that. So we're going to talk about wellness, and I'm going to talk about wellness and kind of a structure for understanding wellness, and try to talk a little bit about how COVID has affected our wellness, kind of the dynamic way it has affected our wellness. We're going to talk about how COVID kind of challenges our wellness. I'm going to talk about the question like, how do I prioritize my wellness activities? Y'all are residents, so time is a premium. So how are you going to kind of understand how the current pandemic, in addition to your already hectic and crammed schedules, like how am I going to prioritize improving my wellness during this time? And I'm going to give you one really good resource that I found recently that has just been really helpful for a number of people that I know. So how do we understand wellness? I'm not going to spend forever trying to give you some kind of fancy definition of wellness. Wellness is kind of exactly what you think it is. It's not kind of the absence of disease, but it is the ability to feel like you are living kind of a healthy, satisfying life. Even with stress, maybe you may be stressed in that, you may be dealing with very strong emotions with that, but what is your capacity to feel like you're leading, a life that is kind of fulfilling and that is, and it feels healthy to you? There are lots of different ways to define wellness, and there are lots of different ways to think about it. In this hope of kind of going back to the basics, I want to highlight kind of a pretty early basic theory on wellness. I mean, how many of y'all have heard of Maslow's hierarchy of needs?
Yes.
Yes. Dr. Yes. You have? Okay. So for those of you who took a basic intro to psychology course, what Maslow said is that we as humans all try to become what he called self-actualized. And what that means is you try to become an individual who has a sense of morality, a person who is creative, a person who kind of lacks prejudice, a person who can accept facts, can accept reality for what it is, kind of a psychologically whole person. That we all have that capacity, but we also said is in order to reach that, we have to deal with a number of other issues first. That there's kind of a hierarchy of needs. And if we don't deal with kind of address our other needs, we'll never kind of reach that place. So first of all, kind of the base of the pyramid is going to be physiological needs. Like, what are our physiological needs? And those are going to be really basic, right? Breathing, eating, sleep, sex, those kind of basic drives. The next level above that is going to be safety, right? So do we live in a safe neighborhood? Do we have resources to care for ourselves, to care for our loved ones, right? Is our employment stable? Do we have money? Do we have a car? Do we have kind of those things that we need to make our kind of daily ins and outs kind of work well? The next level above that is kind of loving and belongingness. You can think of this as relationships. We are social creatures, right? We're pack animals. We're social creatures. And in order to be kind of psychologically well, we have to have some level of connection with others, okay? It can be friendship, family, intimacy, kind of those sorts of things. And you can see each of these levels like builds on itself, right? So you can't have a sense of safety unless your physiological needs are met. You can't have a sense of belonging in relationships unless your safety needs are met, or those relationships aren't going to be as good unless those safety needs are met. The next level is esteem. Okay, so it's how we feel about ourselves, how we feel about ourselves in context of other people. You can think kind of self-esteem here. Do we like ourselves even? And then that last level is self-actualization. So one of the issues with COVID that I think is really kind of interesting and unique in some ways to this is basically the entire world has been kind of thrown a bit upside down in this. And we've got this pandemic that in many ways is kind of going after multiple levels of needs, kind of multiple places in this hierarchy. Okay? And certainly this has happened in the past, but I think definitely right now we're all kind of facing this kind of multi-level challenge to our own health and wellness. Okay? So what are the different ways that COVID impacts these kind of basic needs? Okay, so we think physiological needs. Obviously, some of us are vulnerable to COVID. Obviously, some of us have family and friends who are vulnerable to COVID. Hopefully, most of us don't get COVID. But beyond the actual physiological threat that COVID poses, right, there's also other physiological threats, right? So a lot of us have struggled to sleep, right? A lot of us have had food insecurities because there's panic buying, right? Many of us have been maybe less active. Maybe we've had less opportunities to exercise. And so physically we don't feel as well, those sorts of things. So it can certainly threaten that. It can obviously threaten our sense of safety. Y'all are in and out of the hospital. Y'all are in and out of clinics. Many of you are exposed to people who actively have COVID and who are contagious. And so that is a threat to our safety, especially combine that with the fact that PPE has been a struggle, right? And the recommendations around PPE has been a bit of a target, right? Can it be cleaned? Can they not be cleaned? Are face shields and masks, how effective are they? What do you need? Can we get the N95s we need? Well, a little less true here, but actually maybe really true in terms of if you all have significant others, spouses, partners, those sorts of things, for whom their employment has been affected, right? So there may be challenges to our resources. When we think about our children, those of us who have children, sending them back to school, and whether or not that's going to be okay, do we have the resources to manage that? Where we're going to send them, and are they going to be safe? Those sorts of things. There are lots of social needs, lockdowns and quarantine, our limited access to family and friends. I've certainly seen my family a whole lot less of the past since March, than I typically do. I've gone over a year without seeing my parents. I see them every 4 to 6 months, and so that's kind of a challenge. Our esteem needs. Many of us are transitioning to a lot of more remote work, right? So I know in family medicine, a lot of our residents are doing a ton virtual health visits. Well, those honestly may be kind of less personally validating. That can affect kind of our sense of self and how we feel about ourselves. And then self-actualization, you can't really get there unless these other issues are addressed, right? Any questions about any of this? No? Okay, and again, going back to this, right? It's not like we get stuck at one level. COVID affects, it's a little bit like a shotgun, kind of a peppered shotgun scattered, right? It kind of gets us in multiple places. And so we might find ourselves simultaneously struggle with interpersonal connectedness, while at the same time, we've got a spouse whose employment is limited. And so that's threatening us financially. So if we think generally about the sorts of things, so as you're thinking about your own wellness, one way to kind of organize yourself is to think, okay, where in context of Maslow's hierarchy of needs, where do I need to address my wellness, right? Is it a threat to kind of our physiological safety, right? Our physiological wellness, right? So what do I need to be doing here? Exercising, nutrition, sleep, relaxation, meditation, things that might help us kind of physiologically kind of calm our bodies. What about safety needs, right? Social needs. How do I maintain social connectedness while at the same time maintaining kind of physical distance? How do I deal with my esteem needs, right? How do I deal with the fact that all of a sudden I'm doing a whole lot of work that maybe I didn't think I was signing on for, and that has changed kind of the way I conceptualize myself and in my job and how successful I feel. How do I deal with that? How do I deal with these kind of endless virtual meetings and seeing patients virtually and that, how do I deal with that? Practicing a lot of self-compassion, maybe shifting your expectations, kind of recognizing that, hey, this is kind of where we are now, but it's likely to be very different in a year, those sorts of things. So again, as you're thinking about your own health and wellness, I want you to be thinking about these different levels. Okay, but to kind of transition to a more, what I hope will be a little bit more practical for y'all, is I want to draw on a really neat intervention, kind of counseling intervention that was developed a few years ago called Psychological Skills for Recovery. This is a really, really neat intervention. It was in kind of a counseling intervention that was designed by people who
If y'all can hear me, somebody give me a thumbs up or something.
We hear you.
Okay, let me try to get a hold of Dr. Trotter. I'm not sure what happened to his feed because obviously it's not the Zoom. Let's see if he's still on. Dr. Trotter, you there?
I am. I'm not sure what happened. I think I may have an unstable connection at Student Health. I'm sorry. Did I just like randomly go away?
Yeah.
I got tired of talking, so I just left. So sorry. Where did I leave you all? Can you all hear me?
It was right at the very beginning of the structured, I can't quite recall the name.
Psychological Skills for Recovery?
Yeah, just at the beginning of that.
Okay. Yeah, I'll bring this back up again. Can you guys see that? Okay. Y'all can hear me now?
Yeah.
All right, if I disappear again, I'm not sure what's going on here, but we've had IT problems. I'm over at the student health building. So what psychological skills for recovery are is, like I said, it's an intervention that was developed to help people develop resilience and to be able to navigate traumatic experiences. And even if that traumatic experience is continuing, but to navigate that in a way that helps people to resolve that trauma in a way that helps them to be more resilient, helps them to be healthier, as opposed to resolving that trauma in a way that leads to psychological problems. And so there are really 6 basic components to that. And the great thing about this is you can totally use this for yourself. You can use this for your loved ones to help them develop a plan that helps them to navigate this stressful time. And another great thing about this is, like I kind of said earlier on, is none of this is rocket science. These are all things that are actually fairly basic that we can apply in our everyday lives. A lot of this isn't new. It's just a way to think about, how do I organize myself in a way that, given the fact that I don't have a ton of time, maybe that I don't have a ton of resources, how do I organize my wellness plan in a way that makes it as efficient as possible? If I only have 10 or 15 minutes a day or 5 minutes a day to really engage in something that improves my wellness, how do I choose what I'm going to do, and how do we get creative about that? Okay, so I'm going to go through these 6 things. The first is kind of gathering information. The next is problem solving. After that, engaging in meaningful activities, managing our reactions, how to engage in helpful or healthy thinking, and having healthy connections. So I'm going to go through this again kind of pretty quickly, because again, my hope is that none of this is really new. Okay, so gathering information. It is really critical that if we're struggling emotionally, psychologically, it's really critical that we first start by trying to understand what are the problems that we're experiencing, right? I love this quote by Albert Einstein. If I had only 1 hour to save the world, I'd spend 55 minutes to finding the problem, only 5 minutes finding the solution. That's actually really, really true. If we really spend some time trying to understand kind of what is the issue, if I'm not feeling well, what's the problem? Then oftentimes sitting that time that we spend trying to define the concerns that we have often very naturally leads itself to productive solutions. So that's why we always start with kind of an assessment. I'll actually show you an assessment that I did on an app kind of at the end of this. We'll talk about different ways to do this. But there are really 3 ways that you can go about doing this. And often I suggest that we kind of engage in all 3 of these ways. The first thing is we can take an assessment. I know that may feel a little cheesy to us, but honestly, especially during times of stress, most of us aren't all that good at recognizing how we're doing, right? We get stuck in a mode where we're just trying to make it through the day. We're trying to get to the next task. We're trying to focus on what we've got to do today and then tomorrow, and then plan for kids going back to school, or what am I going to do with X, Y, and Z, right? Normally we are so distracted that we don't pay a whole lot of attention to how we're doing psychologically. And because of that, sometimes we think we're doing better than we actually are. And I'm as guilty about that as everyone, right? And I tell you, especially early on in this, I was so busy that it took quite a while for me to realize that, man, I'm really burned out. And had I kind of recognized that earlier, I think there might have been more opportunities for me to function even better in the context of all of this. So taking a standardized assessment is a great way to get started. I'm going to talk about the COVID Coach. This is this app that I found recently that is really great, has a lot of great skills in it. So you can use the COVID Coach. It actually has a standard assessment in it. I'll show you what that looks like here in a bit, and I'll show you kind of what my score was as of last Thursday. There's another app that I really, really like. It's called the Provider Resilience app. This is a great app for people who deal with a lot of trauma in their work. So mental health providers obviously deal with a lot of trauma in their work, but I know a lot of our primary care doctors deal with a lot of trauma. We work with a lot of patients who have a lot of trauma. And when I use the term trauma, you could use kind of both psychological trauma and physiological trauma. So our surgery residents and our ER residents, that kind of trauma also affects us. And so the Provider Resilience app is an app specifically designed to help monitor the effect that trauma is having on our lives, and then to develop a plan to make sure that trauma, that we're kind of digesting that trauma well, that we're processing that trauma well. Okay. It's kind of a funny thing that we know about trauma, whether it's we're consuming psychological trauma, like we're hearing people's trauma stories, or we're seeing a lot of like physiological trauma. And kind of an interesting thing about trauma is kind of whatever form it takes is it tends to build on us. It tends to build on a provider. It kind of tends to stack up. And if you don't kind of digest and process it, sometimes it can cause problems. And so the Provider Resilience app is designed to help us in other ways kind of metabolize the trauma. The last one is the Maslow burnout inventory. This has been around a long time. You can get kind of 1 million free versions of it online, and it's a good evidence-based assessment. So you can start with kind of one of these 3. Another thing that is really, really critical is, in addition to doing one of these standardized assessments, is literally just to take a few minutes and check in with yourself. We don't do that often. Again, we're kind of so focused on what tasks we have to do next that sometimes we need literally 5 minutes of a breather to think, okay, how am I doing? And to just ask ourselves that question. How am I functioning? How does my body feel? Do I feel exhausted? Do I feel irritable? Do I feel angry? Do I feel numb? Checking in with ourselves, and also checking in with trusted others. I'll tell you, a lot of times my wife or my family members or really good friends of mine will notice that I'm struggling before I do. And so when I've got those relationships with trusted people and they say to me, hey, I'm noticing X, Y, and Z, how are you doing? I tend to pay attention to that. And hopefully you've got someone in your life who you trust enough to kind of hear that from. It can be hard to hear from another person, hey, I don't think you're doing all that well. And I hope that you have someone in your life that you trust enough to let you give you that feedback. So the first is defining the problem, like what is going on with me in the moment, okay? Once you understand the problem, we're going to go back to Maslow's hierarchy of needs, right? We need to figure out, okay, what are the problems and what's affecting those problems? And are there problems, especially if they're around physiological and kind of safety needs, what are the problems there that I just need to fix? Because if I don't fix them, it's going to be really hard for me to be psychologically well. Okay, so we focus on basic problem solving skills. So first we need to solve problems, especially those around physiological and safety needs, right? Am I having financial or housing problems? We need to go address that, right? And we're having kind of safety problems with my kiddos at daycare. We need to go fix that. Do I lack the PPE that I need for either professional or personal use? And I need to go try to solve those problems as best I can, right? Not all of those problems are totally solvable, but if we can kind of check off the problems that can be solved, we really need to do that. So then address problems that can be solved and that are yours to solve. Sometimes we see problems that other people have, and we try to solve those, and that's really good. We should be helping others to the best of our ability, but we need to also make sure that we're solving our own problems, because if we don't, then we're going to burn out. We won't be able to help anyone. Rely on your good problem solving skills. And here's kind of a cycle of good problem solving skills: defining the problem, analyzing it, identifying potential solutions, choosing a solution, creating a plan of action, and then implementation. So kind of go back to the basics, right? Engage good solid problem solving skills. Is kind of a weird side note about problem solving. Most of us think that we're really awesome problem solvers, but the truth is most of us kind of stink at it. And I am one of those people that kind of stinks at problem solving. We all struggle a little bit. The number one problem that people face. Well, actually, there are really two problems that people face with problem solving. One is they don't spend enough time defining the problem. But beyond that, most people just go with whatever the first solution they thought of was. And oftentimes that first solution isn't the best. And so when you're solving problems, get creative and think of as many solutions as possible. That often can be very, very helpful. The next is engaging in positive and meaningful activities. When we get really stressed out and things are chaotic, what happens is we stop engaging in those activities that bring us either a sense of pleasure or a sense of meaning. When that happens, the kind of positive reinforcing parts of our life start to fall away. And if that gets too severe, then we can really see ourselves falling into an episode of depression. In fact, a lot of CBT kind of researchers believe that depression is really a function of someone having an environment that has little to no reinforcement in it. So it's really important that we continue to engage in activities that we find pleasurable and fun. That's really nice, but even more importantly, that we find really meaningful and deeply satisfying. And sometimes those aren't even things that are all that fun, but they are things that give us a sense of meaning and direction, right? Here are just kind of ideas. Engaging, a day at the lake, or you probably don't have a full day, right? But taking a ride on your bike around the block for 5 minutes, doing something that provides meaning. So reading a bedtime story, whatever it is that kind of brings you a sense of meaning. Doing something that you've been putting off for a while, or at least starting something you've been putting off for a while. That can give you a sense of accomplishment. Things that you've mastered, so things you're really good at. Engage in one of those things. Again, this doesn't have to be something that you spend 2 hours doing. It can be literally something that you can spend 5 minutes doing. Something that provides you a little bit of recharge. You can kind of think of it like your cell phone, right? Sometimes your cell phone is battery is well on its way to dying. But if we can just plug it in for 5 minutes, it'll get me through the rest of the day. So sometimes that's what we're doing in order to maintain our wellness, is we're recharging ourselves for 5 minutes. That way we can successfully kind of complete the day. Managing reactions. It's important that we learn skills to help us manage our strong reactions. We're going to be stressed. We're going to struggle with irritability. We're going to struggle with sadness. We're going to struggle with anxiety. And it's really important to develop skills that help us to kind of manage that. The app that I'm going to show you has a ton of skills to do just exactly this, learning how to manage how we feel. Another way, kind of a simpler way to put this, is learning ways to help us kind of psychologically and physically calm down. Okay, sometimes we get just so amped up, especially in stressful environments. I think of it like this, right? Residency, is this stressful normally, right? This is our baseline. This is where we are with residency, across the board, right? COVID has knocked it up to here, right? So any additional stressors are going to kind of send you in the stratosphere a little bit. So it's important to learn skills to help us kind of physiologically and kind of emotionally kind of refocus, allow everything to kind of wind down. And there are a ton of ways to do this. And the great thing is there's a ton of ways to do this quickly, right? This doesn't have to be you sit down and you meditate for 45 minutes. You can do it in 5, you can do it in 8 minutes, right? And I'm sure some of you know how to do really speedy yoga. I had a colleague of mine, a psychologist, and she does yoga, within 5 minutes. And again, it's just enough to help her physiologically calm down and help her to refocus. Helpful thinking. The app also has a lot to talk. I'm going to show you here has a lot to talk about helpful thinking. It's important to realize that the ways in which we think about ourselves, the world, the future, dramatically affects how we respond and what we experience, right? So if you walk around thinking, this COVID nonsense is going to last forever, that's going to lead you to a place where you're feeling pretty stressful and pretty burned out and hopeless, right? But if we can have more helpful thoughts, right? Yep, this sucks right now, but things look a lot different now than they did 3 months ago in terms of our ability to address this. Things are going to look really different in 6 months or a year. This isn't going to be forever, right? Even the bubonic plague, we were able to get a handle on that. And that was probably arguably a much, much worse plague than we're facing now, pandemic that we're facing now. So the idea here is that all of us have these unhelpful, unhealthy thoughts, untrue thoughts. It's important to recognize that sometimes our thoughts are just taking us down an unhelpful path. And when we recognize that, is to redirect it. And that can be a very powerful tool. And again, this app has lots of things that you can use to help you to accomplish that. Healthy connections. Remember, we're talking about physically distanced, not socially distanced. I actually wish that when they came out with this, they had talked about it being physically distanced and not socially distanced. You know, there are lots of ways to connect. I know this is not as satisfying as it is to be face-to-face with an individual, but it's important that we stay connected and reconnect. We've got lots of friends. We've done COVID cocktails in our front yard. And that's actually been recharging. Is it as fun as, you know, having them over and watching a movie as a group? No, but it is something that helps us to continue to feel connected. Okay. I think I've got about 5 minutes. Is that right? Jay, is that right?
I'm sorry, let me pull up my clock here.
I don't know what time they need to.
You got 7 minutes. So
7 minutes. Okay. So I have enough time to kind of go through the app. If y'all are willing to, I highly recommend that you download the COVID Coach app. It's available on kind of whatever device you've got. It was actually developed by the Department of Veterans Affairs. They got a group of researchers together who are experts in trauma, who are experts in coping, and worked with them to develop a really solid app. It's easy to navigate, and it is really consistent. It provides skills and tools that are really consistent with all of what I've talked about. So you can download it. Like I said, it's free. I'd highly encourage you to pass this off to family and friends. It's just a really, really good resource. There are this first screenshot here is a picture of the opening screen. There are 4 sections. There's managing stress. There's stuff on education. There's assessment tools that you can use to figure out kind of how you are doing right now. I'm going to show you my scores on one of those. And then there's a resource finder. So under managing stress, you can think of this it's a whole huge long list of coping resources. What we know is that people don't cope all the same. We all cope slightly differently. There are skills that speak to us differently than other skills. And the way you cope and the way I cope may be dramatically different. So this has a bunch of skills. You can see, it's a little second screenshot there, coping with stress, what you can do when you're feeling lonely, creating some space for yourself, feeling sad and hopeless, dealing with anger and irritability. So just a bunch of different skills that you can utilize. The next little window is the mood check. Remember I said one of the best ways to learn how to cope with stress is first to understand the problem. It's first to do a self-assessment. This has 4 primary assessments that you can use. One is a general well-being index. That's the one that I used. So that will tell you basically kind of how well are you doing the things that help you to stay psychologically healthy, and kind of where are you on that psychological health scale, okay? If you're just feeling general stress, that's probably the one you want to do. If you feel a lot of anxiety, this one has the G87. If you're familiar with that, it's a great clinical tool. Tracking your mood, that's the PHQ-9. It's a depression inventory. And then if you are struggling with PTSD-like symptoms, or think you might be struggling with PTSD-like symptoms, that track PTSD symptoms is what you want to look at. It uses something called the PCO, which is another evidence-based tool for tracking symptoms related to PTSD. So what I'd recommend is download it and then do these assessments and kind of figure out where you are on the different assessments. And then each of those assessments will lead you to skills that might be helpful for you. It will kind of give you a starting place when creating a wellness plan. There are a bunch of resources available. And so that's this next is the resources tab. So finding support, finding help in a crisis, substance use, if that's something that you're struggling with, what local COVID resources are available. And the last one is the Learn page. And the Learn page, it provides a lot of psychoeducation around COVID and stress and coping skills for those of you who really want to kind of understand more about what's happening and why you feel maybe the way you feel and what it takes to stay healthy. There are a lot of resources there. Okay, so I told you I would show you my feedback. So I took under the the mood check, I did the tracking my well-being. And I think this is a 1 out of 100 scale. I scored a solid 49, right in the middle. Okay, so what does this say about me? It says my current well-being score is right in the middle of the range. It seems like I've been able to keep myself feeling okay. And I will say that's pretty accurate. I feel okay. Not great, not terrible, but okay. Even though a challenge is happening, some moments of peace and happiness. I want to check out the managing stress. Those times I'm feeling stress, I would suggest I may spend some time with some positive energy tool and take a mental vacation. I actually do that. I take 1 or 2 5-minute vacations a day. Again, it's like plugging in my phone for 5 minutes. It gives me a little bit of charge to kind of keep going. May practice deep breathing exercise to regulate anxiety. Check out the activities tool, and consider setting a small daily goal. So that's the recommendation for me. Okay. There's also under that under the mood check, you'll also see a goal setting tab. This is a screen from the goal setting. I didn't put up my current goal. My current goal is to eat lunch every day. I know that sounds like a weird goal to set, but when I get stressed, I stop eating lunch. And if I find that if I actually stop to eat lunch, I do better. And so that is my goal for today. I have not succeeded in that today, but I plan on it after I'm done with my last meeting at 2. Better late than never, right? So we're running out of time. I was actually going to take you guys through one of these exercises, but I've got just a few minutes before I wrap up. Are there any questions, thoughts? This is a really good resource. There are other good resources. I mentioned earlier on the Provider Resilience app. That is not a COVID specific app, but again, is really good for people who work in environments where they witness a lot of trauma, either psychological or physical trauma. And it provides many of kind of similar resources, but again, geared towards people who kind of have to psychologically consume a lot of trauma. Any questions about any of this? No? Okay, well, if anyone has questions or concerns, I'm happy to be here for you all. I'm happy to provide resources. Feel free to email me at any time. My email is just david.trotter@TTUHSC. I'm happy to answer questions. I'm happy to connect you all with resources. As I always say, kind of with everyone, if you are struggling really significantly, don't hesitate to reach out to resources. We've got the Employee Assistance Program. They provide really good resources. I also sit on a committee called the Physicians Health and Wellness Committee. And it's a group of us who are specifically here to advocate for physicians, residents, medical students who might be struggling in various ways, substances or emotionally struggling with things, and we can help identify resources for you. It's also a completely confidential committee, so if you were to approach me about that, it would never end up on your on your record here, and so I can kind of be a resource for that too. And as always, if you're struggling with thoughts or wanting to hurt yourself or anything like that, please, please, please reach out for help. There are people who want to help. Okay. I'm going to stop sharing my screen. Any other questions? Or any questions in general? Okay. Well, thank you all very much. I appreciate y'all giving me a little bit of your time today.
Thank you, Dr. Trotter. And just so everybody knows, we'll make sure to collect all of these resources that Dr. Trotter had mentioned today, and we'll get them out to everybody. And we're also working to make sure that these sessions are recorded and made available to everybody. So thanks for y'all that were able to come, talk to your other residents about it, and we'll get all of that out to everybody. So thank you, Dr. Trotter.
Thank you.
Y'all have a good afternoon.
Thanks. Bye.